gathered once again. Good evening, everyone who's joining us for our Caribbean Climate and Health Responders course. It's been going great so far, both the lectures and the practical sessions. So thank you for joining us this evening. This is our special lecture this evening from Professor Chris Aura, who I will introduce shortly. And our opening slide here shows floods, hurricanes, and landslides, which are hallmarks of our climate impacts in the Caribbean. So just to remind you, we've had lectures, an opening lecture, and then hurricanes, food and waterborne, heat, and degraded air quality was last week. And so this week, we're on to Vector-Borne and Zoonotic Diseases, which is going to be delivered by Chris Aura, Prof at the Trinidad and Tobago School of Veterinary Medicine. I'll introduce him more fully shortly. And next week's mental health. A lot of folks are concerned about that, so we hope you'll join us then as well. We've had skills and practice sessions, greening your practice, health, climate and health communications, mental health, heat and mental health last night, and that was fascinating. For those of you who missed it, you missed a treat. Very engaging. A lot of audience engagement. Next week, we have a clinical case on flooding and mental health. So we hope you'll join us for that. And then the last session will be very interesting, early warning tools from the Caribbean Institute of Meteorology and Hydrology that can help practitioners, physicians, nurses, environmental health, academics in understanding better our weather and changing climate. I want to remind you to please put all your questions in the question and answer box on the Zoom. Please put all comments in the chat. Log in using only your own link and remind you about your reading assignments for the different sessions. CME credits, reminding you, are provided by the Accreditation Council for Continuing Medical Education. And you are required to apply within 2 hours of the close of the session. And both the didactic sessions and these skills and practice sessions count towards CME credits. You do have to pay for CME credits if you wish those. The course is free, but you have to pay for CME credits. And the deadline is midnight tonight for paying. So those of us Caribbean people that left it for late, you got to pay today. Let me now, I have the pleasure in introducing Professor Christopher Aura, who is at the UWI Trinidad and Tobago School of Veterinary Medicine. I've known Chris for quite a few years. I don't remember exactly how much, but he's practically an adopted Trini and an adopted Caribbean person. Chris is done a lot of work on vector-borne diseases. He's a professor of veterinary virology, and I think we're going to enjoy hearing from him on the ins and outs of how climate's affecting our vectors and what we've been expecting and what we can expect in the future where climate is concerned. And that'll help us to be more resilient and better prepared for what's ahead of us. Without any further ado, I'll then switch it over to Chris.
Great. Thank you very much, James, for the introduction. Let me just share my slides with you. Very good evening to everybody. It's a great pleasure to be here on this course. Thank you very much for inviting me today. I hope everybody can now see my slides. I'll put it in presentation mode. So it's a real pleasure to be here. I've really enjoyed the presentations up to now and learned an enormous amount. And I hope today we're going to go through this very important topic together in the next, I think we've got about 60 minutes, so we might be a bit quicker than that, where we'll be talking about how climate change is likely to affect vector-borne and zoonotic diseases. So you've got the very quite extensive learning objectives, which I'm sure you've all read in detail. It's a lot. And when I saw these, I thought, my word, am I going to cover all these things? So we will be scratching the surface a little bit, but I'll be giving you hopefully some of the key points to look out for as health professionals in the Caribbean. So I'm going to be explaining a little bit about environmental processes that are changing with as a result of climate change and how they're affecting vector-borne and zoonotic diseases, and give you some examples now. I won't be able to go through these in too much detail. I'll give you some human examples, and as I'm a vet, yes, I'm going to give you a very good veterinary example as well. I'm going to talk about a little bit about, as well as vector-borne diseases, the drivers for zoonotic disease and how climate change is likely to increase, talk a little bit about pandemics and zoonotic diseases, as this is obviously the flavor of the year at the moment, and then talk a little bit about you and how you should act and what our health sector should do to try to prepare ourselves a little better. So I'll start off, I'll start off with a few definitions, and then I'm just going to try and get rid of this. Oh yeah, let me put it up there. Great, the bar. I'm going to start giving you a few definitions so you know what vector-borne, what zoonotic diseases are. I'm also going to mention a few times in this lecture One Health, and I think many of you would have come across One Health. I think it's really important to understand that we need to look at these things from a multidisciplinary perspective, and we need to understand the connections and the links between human, animal, environmental health, and how they're inextricably linked. And if you affect one, you affect the other. So we all need to be One Health practitioners when we're looking at the effect of these kind of diseases. I'll talk a little bit about, start off by talking a little bit about climate change and how it might affect infectious diseases and pathogens, just a small amount because that wasn't on my remit. And then I'll talk a little bit about vector-borne diseases and how they might affect, give you a few examples, and also talk about zoonotic diseases and a little bit about pandemics. And as I said, then we'll go on to what you can do and what our health sectors can do. So if you have your seatbelts fastened, we will start, and I look forward to the questions at the end. And luckily we have James here as well, who's also an expert in this area. So any questions that I can't answer, James will be able to kick in. So vector-borne diseases are infections transmitted by the bite of infected arthropod species, such as the many arthropod species you know about. We all know about mosquitoes, very much in the Caribbean, but we also have biting midges. The no-see-ums, they're called no-see-ums because they bite you in the morning and night, and you don't see them biting you. They're the little midges, and they carry a lot of diseases as well. There's ticks, which we all know about. We can usually see those. There's these triatomine bugs that are really nasty. We have them in Trinidad, and they transmit Trypanosoma cruzi or Chagas disease, which is a really nasty disease. There's sandflies, which we have in the Caribbean as well, which transmit leishmania, and there's black flies as well, onchocercosis. So we have these arthropod vectors. The critical thing about these arthropod vectors is they're cold-blooded, or what we call ectothermic. And therefore, they're especially sensitive to climate factors. They can't regulate their own temperature like we can. So that means that they are throughout the arthropod, they become the temperature around them. So if the temperature around them changes with climate change, etc., then a lot of things happen with that. And I'm going to talk a little bit about zoonotic diseases, or zoonoses, or zoonotic diseases, or zoonoses plural. And a zoonotic disease is an infectious disease that is transmitted between species from animals to humans and actually back. And some people say reverse zoonosis, but I always say it's both ways, but there's a bit of a discussion about that. But these are diseases that are passed from animals to humans and back. And we know many of those, and we'll talk about many of those. I don't have to talk to you about the climate change issue, the global warming issue. We know what's happening, and we can see it in this horrible graph here with the temperatures rising and all the effects we've heard about of these temperature rises, direct and indirect effects that are affecting so many things that we've heard about in previous lectures. So these also affect vector-borne diseases, infectious diseases, and zoonoses as well. So very busy slide. You don't have to look at it all. It's just to give you a sort of picture. Many of you will know about and have heard about and have even had patients who have these nasty diseases. We don't have so much malaria in the Caribbean, but it's certainly knocking on our door, especially down here in Trinidad. We all know about dengue. We know about yellow fever. We remember Zika, and Zika may well come back. We remember chikungunya, and chikungunya may well come back. Just talking about that with James, they haven't gone away. And then there's these are obviously these ones are viruses. Malaria is a parasite. Then we have Schistosomiasis, which is a trematode, a worm. Onchocerciasis, which is another nematode, a worm. Chagas disease, which is a parasite, apicomplexan parasite. There's Leishmania, which we all have close to us in the Caribbean, if not in the Caribbean. And then there's a few others here that are a risk to the Caribbean, Japanese encephalitis. We have Lyme disease, which some of the people listening from the USA will know a lot about. We also have West Nile and Tick-Borne encephalitis. And these are carried by different pathogens, as you can see here. Different viruses, different parasites, some trematodes, some nematodes, some apicomplexan parasites, different types of pathogens. And they all have, these are vector-borne diseases, so unsurprisingly, they have a primary vector. And you can see they're all different. And you know, things like mosquitoes, they transmit certain pathogens. Anopheles mosquitoes transmit malaria. And we have these Aedes mosquitoes that transmit yellow fever, Zika, chikungunya, and dengue. And then we have other vectors like snails, like these bugs, these sandflies, etc., that I talked about. And some of these diseases have primary non-human reservoirs and some don't. So in some of them they've adapted so they transmit between humans and the vector. So for example, in dengue, between these Aedes mosquitoes and humans. And some have an animal reservoir host, be it mammals, rodents, pigs, domestic animals, small rodents and birds. And so when you're looking at all these things, you're looking at how will climate change, how will increased temperatures, how will the effects of climate change affect all these things that are involved in the life cycle of the vector-borne disease, how it will affect the virus, the parasite, the pathogen, how will it affect the vector, how will it affect the reservoir hosts. And so there's many, many different factors involved. So it's quite a complicated picture. And it's not as simple as, yes, the climate will change, temperatures will go up, so we'll get more dengue, we'll get more West Nile, it's not as simple as that, as I explained. However, clearly climate change is going to have an impact, a big impact on these things. I'm going to talk, actually say a little bit on zoonotic diseases as I go through, and there are many, many zoonotic diseases out there. When you look at different parts of the world, you get priority zoonotic diseases that affect different areas. In the US, you've got these, we've got influenza, zoonotic influenza causing a massive issue, avian influenza at the moment in the States and Canada, a real risk to the Caribbean. This is one that's not very easily transmitted from birds to humans, but it can be. But of course, we all know that the avian influenza viruses have the ability to adapt and change very easily and jump to enable them to jump species. So influenza is a real worry from a zoonotic disease perspective. Then we have these other ones, Salmonella, which we heard about in earlier talks, foodborne diseases, West Nile, which is a zoonotic vector-borne diseases. We have emerging coronaviruses, which of course we all know about. They're zoonotic diseases as well. As we know very well, they've come from bats into humans, probably through a livestock host or an animal host. We've got rabies, real issue in Trinidad at the moment. We've got a rabies outbreak through vampire bat transmitted rabies, which is coming through animals, coming through ruminants, which are going down with it. And of course, humans and dogs can also be affected by the same virus. So this is a big issue. We have brucellosis down here in Trinidad in our cattle, and of course, Lyme disease as well, which we've talked about. And this particular graph here looks at the slightly different priority zoonotic diseases in the Americas, taking into consideration Central America and South America. So there is a different priorities, with rabies and leptospirosis being major priorities. So I'm going to ask you this question now. Please, first Zoom question should be very simple. I'm expecting everybody to get it right 100%. So we're going to give you just a few seconds to answer the question. It's important. It's an important question to know. So I'm going to shut up for a moment and see how you get on with answering it. And we should get the results up in a moment. And yes, most people have got it right. Well done. The really important thing is here, yeah, a high percentage of new and emerging human diseases, the kind of ones that you all know about, dengue, chikungunya, Zika, Ebola, salmonellosis, all those kind of ones, 75% of them actually have made their way to humans through animals. And so this brings me on just briefly to the importance of that and One Health, because we know that most vectors feed on a wide range of hosts, different animal species, human species, so they transmit very many zoonoses. They don't often always feed on one host, yeah? And many pathogens are reservoired, as we saw from the previous slide, in wildlife. And so if they're given the opportunity, close contact to humans, they will spill over, possibly through livestock and then into people. So we need to not give them that opportunity. We need to make sure that we respect wildlife in their habitats and we don't move into it. I'll talk a bit more about that later. The other thing just to mention is that hosts, we talked about the hosts earlier, they can be amplification hosts, so they can set up a viremia high enough to infect vectors. Or in some cases, they can be what's called dead-end hosts. So they get a viremia, but it's low, so that the virus levels in the insect are not enough to infect more vectors. So they don't pass the disease on. And we'll see examples of this like West Nile virus, where humans are actually dead-end hosts. But what this really emphasizes here is that animals play a really important role in the spread of these viruses to us, to humans, and preventing transmission in animals can protect humans. And this is all about the One Health approach. And this really is emphasized by this particular figure here, where you see this big curve here, and this is the cost of to control an outbreak. And you think about this with SARS-CoV-2 or COVID-19. So when it's in the bats, for example, the cost is very low. If we did something about, kept it there, we keep the cost down. But when it gets across, when you see clinical signs in the animals, the cost goes a little bit up. But when we allow it to jump across into humans, it spill over into humans, and we see clinical signs in humans, and then humans seek medical care, the cost goes up into trillions. So the big issue here is keep left. Try to avoid all these many pathogens that are zoonotic and get across into humans. Try to avoid them coming across by keeping them in animals, yeah, and not allowing them. And this is really part of the One Health approach: healthy people, healthy environments, healthy animals. And I wanted to also just show you that you're involved with this as health professionals or doctors. We might have other people, scientists, entomologists, we might have social scientists, health economists here. But when you're looking at trying to address these issues, vector-borne diseases or other issues, from this multidisciplinary One Health approach, we need to make sure that all the important expert parties are involved in the process, are sitting around the table, yeah. And this may change as to who's in these balloons around the outside, according to what we're dealing with, whether it's virus, whether it's antimicrobial resistance, whether it's Zika, whether it's chikungunya. But I gave Zika as an example, and here we see, you know, all the input that's needed, the human medicine input, understanding the pathogenesis, the microcephaly, who's being infected, that little window of opportunity when this virus moves across, being able to discuss this with the patient, transmission mechanisms, entomology, the research scientists, the entomologists, understanding which mosquitoes are transmitting it. Always environmental input now. With climate change affecting our environment, we need climate scientists, we need urban planner, we need environmental scientists to understand the impact of climate change on these diseases, be it Zika here, and absolutely critically, the social and economic inputs. Social scientists, communities at risk and health economics, understanding the impact of these diseases on communities and both economic and social, because this is what's going to get these policy guys to actually do something about it, these civil servants, to release the money to actually act. We also need the private sector and pharmaceutical industry to be involved. We need vaccines, we need drugs, we need and critically we need animal input. We need input from vets and wildlife experts, because so many of these viruses, including Zika, are likely to have an animal reservoir. So we need to understand that. So that's sort of by way of an introduction, really, into and I'm going to go more now into just a little bit into infectious diseases, and then talk about vector-borne diseases and zoonotic diseases. So from an infectious diseases point of view, I'll keep things very short, but climate change may well affect the spatial distribution of outbreaks, where an outbreak is, the timing of a disease outbreak, when will it happen, the frequency of a disease outbreak, how often will it happen, the intensity or severity of outbreaks, how bad will it be. It also, climate change will have effects on, as I said earlier, the different elements that are involved. And when we're dealing with vector-borne diseases, we're dealing with pathogens, hosts, and vectors. Pathogens, if they live outside the host, will be susceptible to the environment, the climate. Hosts, it's critical to know, are they immune to that particular pathogen? And if they move to areas through, for example, climate change migration, they're going to be susceptible. The vectors we'll talk about in a minute, and also the dynamics of this, the dynamics of the infections between the pathogens, hosts, and vectors, and the contact rates between them is going to be affected by climate change. And of course, there will be indirect effects, which are drivers, which I'll talk a little bit about as well. So climate change and pathogens, the pathogens need to get from one host to another. That's what their raison d'etre is. That's what they're doing. So many pathogens spend time in the environment, as we know. So they're exposed to the weather. So if that weather is harsh or that weather changes, that's going to affect the viability of the pathogen. So, you know, it's clear that if climate change gets much hotter, or you get adverse conditions, that will affect the pathogens. Climate change will affect pathogen development time and survival. It'll affect seasons, may make them longer or shorter. Milder winters may increase or decrease between season pathogen survival, and climate change may affect seasonality. And we know about seasonality with, for example, influenza viruses. Influenza viruses, flu, they occur usually during the winter. So if we get warmer conditions, people spend more time outside with their windows open. The seasons are going to change. They're likely because they're going to have less chance of spreading these kind of viruses. And of course, climate change will affect dispersal, as we know with COVID as well. These little tiny droplets, they depend on a little bit of moisture in them. And if that moisture is dried out, that droplet that is transmitted in aerosol in the air, that dries out and the virus dies as well. So the viability of those droplets depends on the climate around it and heat. So these are many things that can be affected. And there are many drivers of disease. And this is an old study, quite an old study, but it's a nice study where they took 338 human diseases from 1940 to 2004. And they were classified, the drivers were classified into 12 categories. And these are still, certainly climate and weather are playing more of a role now, probably since 2004, but these still are there, these drivers, and they're still there today, and they're critical. Land use changes we're seeing, and that's been affected, being facilitated by climate change. Agricultural industry changes to intensive agriculture, that's a driver for disease. Of course, antimicrobial agent use, and this has got so much worse since 2004 with antimicrobial resistance, due the way we're trying to cure or stop these these pathogens that are using antimicrobials. When they don't work, obviously that's a major driver. International travel and commerce, very critical. Globalization, human demography and behavior, absolutely critical. We are the ones that are causing so much of the issues here. Human susceptibility to infection, as I talked about earlier. And then there's medical industry change, war and famine, obviously, because there's a breakdown in public health and those kind of situations. Big food industry changes. One of the major issues we have at the moment is our population. It's going up dramatically. So trying to feed and trying to deal with and accommodate this increasing population is bringing with it so many problems. And in an era of climate change, the situation is going to get even worse. Bushmeat, we know about bushmeat, we know about wet markets, and then quite a small amount at this time for climate and weather, but it is an important driver. So I'm going to put the next Zoom question up just before I start talking about vector-borne diseases, and I'm going to see how you get on with this one. So I'll just take a break and have a sip of my drink and my water, I have to say, not my alcoholic beverage. And I'll give you a couple of minutes or a minute to have a look at this one. Yeah, okay, well done. So I'll get to the answer when we talk about, the vector-borne diseases, which we're going to do now. And if anybody has any questions at the end, we can answer. So the $6 million question here is, will climate change affect vector-borne diseases? The answer is yes, but it's not as simple as a yes. There's a but after it. Well, it will affect, will climate change affect? The answer is yes, full stop. But will they all increase, or will some increase and some decrease? That's what we need to address here. So when we look at this Venn diagram here, as I've said before, the host, the vector, and the pathogen are all clearly involved, and they have to be interacting together. And then there's the center of the Venn diagram. This is the nidus of pathogen transmission. So any effects to these, the host, the vector, and the pathogen, that increases this, you'll get more transmission. And changes, and here we have around the environment, and this is what climate change is affecting, obviously. And changes in temperature and precipitation that we're seeing with climate change will affect the environment in which vector-borne diseases are transmitted, clearly. And these environments may become more or less favorable to the vectors and to disease transmission. And also in some environments, the vectors won't like it, and they'll get up and move because they want to go to a more favorable environment where the habitat's better, whether they feel happier, whether where they might be a bit hotter, or even they might be cooler, because they like certain conditions, like we all do. So they are going to get up and move when the situation gets bad and they don't like the environment around them. And that's going to affect things, because if the vectors get up and shift, you haven't got this nidus in the middle anymore. And there's many good examples of this. We're seeing vectors moving around the place likely because of climate change, but other drivers as well. We see, for example, Leishmania is transmitted by sandflies. I talked about this earlier, which are moving from south to north in Europe. So they're moving to, they're able to move further north because the climate is, the temperatures are increasing. So they're able to sustain themselves in more northern latitudes. Also, they're moving they're moving from north to south, the other way around in Argentina again, where it's getting warmer in the south. And you all know, the people from the US anyway, in Canada and the USA, heat waves where it's getting very high temperatures are causing the northward displacement of ticks, the Ixodes ticks that are responsible for Lyme disease. So we're seeing many more ticks in areas where there weren't before, and we're seeing the transmission of Lyme disease. So so the answer is yes. However, it's not quite as simple as they always get worse. So climate change will affect vector distribution, population sizes, and seasonality. And higher temperatures will affect what we call vector competence and vectorial capacity, which I'll talk about in a second. And it will also affect vector dispersal, as I mentioned just now. And also there's evidence that extreme weather events, like for example, El Nino events, may favor some vector-borne diseases. So after an El Nino event, there will be more likely to be outbreaks of some vector-borne diseases. And this may be because of flooding, may even because of drought. And I'll explain that in a bit, when there's increased opportunities for vector breeding. Here we have the nasty Aedes mosquito. You can see this, we all know this in the Caribbean very well, a very nasty, vicious biting mosquito. That comes out also in the day. It seems to be very voracious. Here we have some biting midges, Culicoides midges, which also, as I said, transmit a lot of diseases. And here we have the Ixodes tick that transmits Lyme disease. So from a point of vector-borne disease risk, it depends on vector competence, that susceptibility of the vector. Is it able to transmit the virus in the first place, or the pathogen? We know some vectors can transmit some, and some can't. But when the climate comes in as so important, is when also it's very important to have the vectors present, or so the distribution and abundance of the vectors relative to the host is critical to how much transmission you're going to get. Obviously, the vector has to be there, and it has to be there in high enough numbers. And also that vector has to be able to transmit the pathogen. And this is vectorial capacity, the ability of that vector to be able to transmit the pathogen. And this is dependent on a number of things, but critically it's dependent on this, what we call extrinsic incubation period, which is the time from taking a blood meal to becoming infectious. And this extrinsic incubation period happens between when the mosquito or the midge takes up a blood meal. The virus will go in the blood, down through into the gut wall. It'll then replicate in the gut wall, then pass through the sort of blood of the insect back to the salivary glands, where it'll actually then replicate in the cells of the salivary glands, and it'll be released into the salivary glands, ready to be transmitted with all the remaining meals that mosquito will take. And that's the extrinsic incubation period. And that, whether the speed at which the extrinsic incubation period takes, or indeed if the virus is able to transmit at all, is dependent on temperature. So in certain times, this is different for different vectors and different pathogens, of course. But here's an example: at certain temperatures between 0 and 10, there's no transmission, because the vector, the virus just can't transmit at that temperature. The extrinsic incubation period just doesn't happen at that temperature. So in temperate zones in the winter, you get no transmission. But as the temperature increases, then the speed at which this extrinsic incubation period happens increases, different for different pathogens, to a maximum amount, usually, and then it reduces when it gets to a sort of threshold temperature, it reduces. And this is different for different vectors. So you can see that under certain conditions, certain temperatures, you won't get any transmission, and under certain temperatures, you will get maximum speedy transmission. At other temperatures, it won't go very quickly, and this obviously affects the ability of this of the vector to be able to transmit. For example, dengue viruses will develop in mosquitoes and be transmitted only if exposed to temperatures within the range of 20 to 35 degrees C. It can't transmit outside those temperatures. And I'm not going to talk about this slide for too long, but it really just does emphasize the importance of this extrinsic incubation period, which takes time, and the mosquito, in this case, or the midge, is taking blood meals throughout this process, and it has a finite life, and it has a finite amount of meals that it will take. And so here we see the meals, 1, 2, 3, 4, 5, 6, 7, for example, and then it dies. And it will only be able to transmit the pathogen or the virus after it's completed its extrinsic incubation period. So these will be potentially infectious feeds here. And the climate or heat or temperature will affect many of these issues. So if you got a higher biting rate, in other words, there was less distance between these, you would see more blood meals. If you've got shorter extrinsic incubation period, you would see more blood meals, as you can see here. And if you've got a lower mortality, you would see more blood meals. However, if you get a combinations of these, which you see, for example, if temperature rises, you get a shorter, you might get a shorter extrinsic incubation period. You might get higher biting rates, but you might also get higher mortality rates, so they die quicker. So it's a complex situation, is what I'm saying, and there are conflicting factors that are changing the ability of a vector to be able to transmit a particular pathogen. These include biting rates, which increase with temperature, mortality rates, which increase with temperature as well, so they don't survive for as long, and extrinsic incubation rates, which increase with temperature and then may come down. So this combined to contribute to the vectorial capacity. And it might be that certain temperatures that are optimized, but then at certain temperatures, it comes down again and they become less able or have a reduced vectorial capacity. And this is why we're seeing very different scenarios when we look at the models. For example, Aedes aegypti, which transmit many of the viruses I talked about, like dengue. When you look at up here on the left, you look at the different times or years, the projections based on the worst case scenario for climate change. You're seeing the blue levels go up right into Canada, but you're seeing blue appearing in areas where you'd get 12 months a year transmission. That's reducing in some areas because the temperature's rising, so the vectorial capacity is reducing because it's going beyond that threshold. Yeah, and in some cases moving north, because of increased temperatures, those mosquitoes, in this case, are able to travel further north because the temperatures are rising, so they're able to find habitats and transmit further north. Now, it doesn't mean that they're all able to transmit just because they can. The number of months per year when disease transmission can occur is, if it's 1 month, they may not be able to transmit still. Because 1 month might not be enough, but we're seeing the geographical ranges changing, which is significant. And I'll just give you a couple of quick examples, which are quite interesting. You all know about Zika virus. We all know about what happened in the Americas. This is was at one stage in Africa a virus that transmitted between the Aedes mosquitoes and primates. It adapted, moved across, and became what we call an urban or periurban cycle between humans and Aedes mosquitoes, and that's where we are now. And there may well be an animal reservoir for it. And we saw it move very rapidly from its heartlands in Africa across into Brazil, and then we all know as it came up to the Caribbean into the USA in around 2015. And we got this virus in all through us across the Caribbean in 2015. And it's interesting that when you look at the risk, the modelers got their hats on and started looking at the risk that at certain years when Zika virus was more likely to take hold and spread. And when we did get it, when it came across around 2015, you can see here the purple, that's an increased risk, basically. So it might have come in years before, but it hit a year in 2015 where there were in place, including likely the climate, but likely other things as well, like the presence of mosquito as well, where there was a heightened risk. And that's why, because of this, it's likely to have then spread and taken hold. And we can see here, when you look at the, again, the risk in 2015, this red bar is at its highest out of ever. This means this year was a bad year or a good year for Zika because the conditions were in place that enabled it to take hold and spread. And I wanted to talk very briefly, and I'm not going to talk because I know I'm talking for too long. I'm a bit behind, so I'm going to talk very quickly. Well, I'm not going to talk quickly, but I'm going to go through some of my slides quite quickly. Blue tongue. This is a virus I worked on in my career a lot, and it's an animal virus that's transmitted through these noceums, these coulicoided midges, and there are many, many of these species present. And it was really interesting back in the early 2000s, where climate change was looking to be moving this blue tongue virus up from Africa into Europe. Now, some people don't believe it was climate change, but a lot of people do. But basically, what was happening was these midges, and there are many different species of these midges, were moving up north. So the African Coulicoides and Amygdala was moving up into Asia and into, southern Europe. And then it was like a baton. It was passing the virus, that each coulicoided species was passing it up to northern European species, and it moved right up into northern Europe. And this is partly because of the increased viral persistence during the winters, as winters were becoming warmer, so it was able to overwinter, which these have to do in temperate climates. They have to get through that nasty winter period. And of course, the northward expansion of these midges, where they were able to then come into the same zone as other local coulicoides midges and then spread the virus onto them. And these local coulicoides midges, because of increased temperatures, had a higher vector competence and were able to transmit it better. So climate change and vector-borne diseases, the summary. So climate change is and will continue to affect the incidence and distribution of vector-borne diseases. Some will increase and some will decrease depending on geography and altitude and where you are. And we need to understand that so we can model that. Climate variability, we know the climate changes. Sometimes the variability from year to year is different, is an important factor, and that may well have been an important factor allowing Zika to take hold and spread, and maybe chikungunya as well. Although there were other reasons for chikungunya as well, why it spread. Climate change is enabling vectors to spread and increasing their vectoral capacity. As we've seen, as temperature increases, they become more capable of transmitting viruses and pathogens. But there are other drivers, as I mentioned, including global travel, trade, and human factors are very significant. So consequently, we're seeing vectors spread in the Americas. We're seeing vectors moving. We're seeing diseases moving with the vectors. And we're seeing new diseases, which were new diseases like Zika and Chikungunya, even West Nile was the new diseases. We're seeing them take hold and spread. And certainly climate is is playing a role in this. And other vector-borne diseases very much lie in wait. I talked about Japanese encephalitis virus and West Nile virus, and Oropouche virus, which is transmitted through these coulicoides midges. So I'm going to change gear in the last 20 minutes. Oh dear, my battery's running low. I wonder why that is, because it's plugged in. Let me just, excuse me for 1 second, and I just check. Oh, yeah, we have a, hopefully that's in now. Yeah, so zoonotic diseases. Of course, we all know about zoonotic diseases with COVID, and there was a nice article recently out explaining about how potentially devastating climate change crisis will fuel future pandemics. And clearly, will they affect zoonotic diseases? The answer is yes. And as the planet heats up, many animal species will be forced to move into new areas to find suitable habitats. And we know it's all about that connection between human and animals, allowing that spillover to occur that enables zoonotic viruses to jump across species. So when they move, they will bring their parasites, their pathogens with them, and they'll interact with people or animals that haven't seen those pathogens before, who are have no immunity, and they will spread the pathogens onto them. And this will heighten the risk of zoonotic spillover. As I said, this is movement from animals to people, potentially triggering, I'm afraid, another pandemic. So let me just show you a very short video. And what I'm going to do is, actually, I think because of time, I'm not going to show you this video because I only have around 15 to 20 minutes left. And I wanted to get across a few really important things in the zoonotic diseases. The video is very nice, so guys, please watch it. It's a lot of scientists talking about the risks from zoonotic diseases, and it's the people that actually came out with these drivers, which are very important drivers of zoonotic pandemics. And we are dealing with these situations at the moment. You can see agricultural intensification is a really important one, enabling viruses to spread very dramatically from animal to animal. Travel and transport, globalization, food supply chains, obviously climate change, which really is a facilitator here as well as a driver. Demand for animal protein to feed us, our ever increasing population. Urbanization and industry, I'll talk a little bit about that in a second. And of course, the overexploitation of wildlife. So when we talk about the emergence of zoonotic diseases, again, we go back to One Health, and I'm very happy to mention it again because it's extremely important, this multidisciplinary approach that we need to take to these issues. And again, as we heard from the first Zoom question, most human pathogens have come through animals. Animals maintain pathogens in the environment, as we've talked about earlier, in wildlife, and we've also got obviously vectors as well. Animals are involved in the spread of pathogens to human, and as we saw, environmental factors are linked to the spread of many pathogens, and climate change will affect those environmental factors, those environmental determinants of health, and they will have a big impact on the emergence of these zoonotic diseases. And this just really emphasizes what I've said already. We have these cycles of diseases in wildlife that if you don't have any contact between wildlife and humans and livestock, they just carry on cycling. They're fine. Everybody's fine. Wildlife is fine. However, when we put domestic animals or we put humans in close proximity to these wildlife and the vectors and the wildlife species are present, then we get spillover either directly into the human population or spillover from the wildlife into domestic animals, and then from domestic animals into humans. And this is really what we want to avoid. And why is this situation getting worse? There's many things that we're doing, and it's all about us. It's all about human beings. We need to get our house in order. Otherwise, we're in serious, and I won't say the word. We're moving into forest encroachment where wildlife are. So we're coming into contact with the wildlife are coming into contact with us. We're living in close association, more close association because of poverty, often driven by poverty. Humans, animals are often living in close proximity, as we see here. And in these kind of situations, this is where the influenza pandemics appear. We see the mixing bowl of influenza, the pig here, we see birds, we see humans, and then giving the opportunity to jump across through these wet markets, all sorts of animals. I mean, you don't want to be there. I've been into these markets in China and other parts of the world, and it's an absolute disaster where the viruses jump across because of poor hygienic conditions. And this is likely what happened with SARS-CoV-2. Human, as I said, high density of human population, unplanned urbanization, movement of people into areas where wildlife, those people are susceptible, then modern agricultural practices enabling the viruses to spread very dramatically from animal to animal, and of course globalization. And as we've said, climate change is an influencer and a driver, and it's going to affect many of these factors. So our key take-home messages from this is domestic animals and wildlife play an important role in spreading viruses to humans. However, we are the ones to blame. We are the ones that need to get our house in order. Don't blame the livestock. We need to change. And to do that, we need to use a One Health approach, and we need to stop the drivers, stop the influencers, and we need to stop climate change, halt destruction of nature, or suffer even worse pandemics. So I wanted to just, for the last 10, maybe 12 minutes, I wanted to talk a little bit about what action you can take as health professionals to really support, reduce the incidence or the seriousness of these diseases, and diagnose them and be more efficient at diagnosing them in your patients. And we've talked a lot about vulnerability and vulnerable populations. And as you know from vector-borne diseases, we know about where the vectors are, where the pathogens are. We know about zoonotic diseases, where they're coming from. There's going to be certain people that you're going to come into your clinics that are going to be more vulnerable. And knowing when and where your patients are at risk is critical, what time of year it is, where they live. And identifying those vulnerable patients when they come in, be it women, outdoor workers, farmers, slaughterhouse workers, children, adolescents, immunocompromised. You need to understand where the vulnerable populations are, and then that will help you to come towards, to take your history and carry out an effective diagnosis. And I want to tell you a little story, which really emphasizes this. When I first came to Trinidad, I was talking about One Health to a whole lot of health professionals, the doctors. And one guy came up to me after the talk and he said, "Thanks very much for the talk, Chris." He said, "You know, this really made me think, because when I was very early young medical practitioner, a boy came to my clinic and he was come from the east of Trinidad. It was school holidays, it was July. There was been a lot of rain about. He was about 16, 15, and he had episodic fevers. He had all the signs, you know, of a vector-borne disease like dengue. There was dengue around. And so this lad, the doctor sent him away, explained to him about dengue, explained to him about the issues of hemorrhagic fever and, you know, all that, and coming back if he wasn't any better. He then went to another doctor because he didn't get any better in his hometown. And then later on, that boy died. That 16-year-old boy died. And so they did an inquiry. This is what the doctor was saying to me. And they went out to where the guy lived. And this is why Hippocrates was right on. And this is something that if you take home one thing from this talk, it is better to know what sort of person has a disease than what sort of disease a person has. And when they went out to where that boy lived, what did they see? They saw him living in quite a rundown area in the east of Trinidad, lots of solid waste around where he was. He was. They asked about him and what he was doing. He was out in the school holidays playing with all his adolescent mates. There was lots of floods about. There was lots of water about, dirty water, and there were lots of mosquitoes about. He was going around with bare feet. He was playing with his friends with bare feet. And of course, you guys, being many of you will instantly know what killed that guy. A disease that has an easy cure. If it had been diagnosed, if that doctor had taken note of what Hippocrates said and actually taken a One Health, and not just a One Health, but a climate change and health history, because that's what you're going to have to be doing. Looking at the environment, looking at where the risks are, looking at what time of year it is, looking at the vulnerability of the patient. This was a young boy. Yes, young men are most at risk to leptospirosis. Yeah. So the nurses out there, the doctors out there, the nurses out there who often take the histories, this you need to think going forward. If you are going to, what actions are you going to take? It's so important going forward. We understand about all these different factors that are going to get worse at certain times of the year and be affected by climate change. But you really have to think about those things. Think about vulnerabilities of your patients, and think about the time of year, and think about the risks, and think about, you know, the age or who that person is. It is better to know the sort of person, what sort of person has a disease, than what sort of disease a person has. So we'll just finish up now, but a couple of slides. As I see, I'm looking at my clock next to me and it's coming to an end. But this brings me to you guys, your health professionals, getting up to date with what's going on, keeping up to date with what's going on. What are the risks? And this brings me to, Andrea was talking last week about the excellent bulletins that are coming out from the CMIH and CARFA, where we're actually able to look in a monthly way, considering the temperatures, considering the times of year, about what are the increased risks from different forms of diseases, be it vector-borne diseases, respiratory diseases, gastrointestinal diseases. So I recommend you to take a look at this, so you have this in your minds about, you know, whether we have higher risks of dengue, whether we have floods around and high risks of leptospirosis, those kind of issues. So you're really aware of the environment around you when you're taking your history and coming towards your diagnosis. So when we're talking about managing the risks of disease emergence, the critical points going forward, where should we concentrate our time and effort? Because, you know, our time and effort, we haven't got all the money in the world, we haven't got all the time in the world, so we have to focus on what to do. We have to target and critically increase what's out there is important, and that's all about surveillance. What do we have out there? And that's important for vector-borne diseases and zoonotic diseases. What do we have out there? Then we can put measures in place to reduce transmission and spread. When it comes to zoonotic diseases, we need to remember this livestock, wildlife, livestock, human interaction to try to reduce the chances of this spillover. Yeah, we need to look carefully at the risk of illegal and legal trade. We have a lot of illegal trade of wildlife, certainly down here in Trinidad, where I'm talking about, and consider how we can reduce supply and demand of wildlife and wildlife meat regionally and globally. And also, from a Caribbean perspective, we need to promote harmonization as much as possible, learn from each other and take a regional approach, because we're much bigger as a region here. And as I said, the One Health approach, a multidisciplinary approach, is so critical here. And my second last slide, or I think my last slide, as I see it's nearly time, and we need time for questions, is a bit broader, what can our health sectors, our governments do to be better prepared for the shifting geographical burden that we've talked about today, because these vectors, these diseases are going to shift as the climate warms. Sometimes they'll get worse, sometimes they might get better, and the increase in zoonotic diseases that we're very, very likely to see as we move forward. So we need to pair viral surveillance and discovery efforts with biodiversity surveys tracking species range shifts. So especially in regions that harbor the most zoonosis, the hotspots, and those areas that are experiencing rapid warming. So these are really focusing on all the higher risk areas where, you know, we're seeing movement of species, we're seeing more zoonosis, and we're seeing rapid warming, because these are like the hotspots where we're more likely to get these spillover events, and we have to try and avoid, because we really have to be proactive to try to avoid this from happening rather than reactive. We see what happens when we're reactive. We're not very reactive. We're very, very slow. So this goes for primary pandemic prevention as well. We need to look at habitat conservation, preserving our wildlife, avoiding movement into our wildlife habitats, regulating our wildlife trade, improving livestock biosecurity, that's stopping these viruses coming across into livestock, and stopping these kind of things like these wet markets, which are terrible risk for this kind of things happening. And I know this has been being done, but we need to design and develop climate-driven spatiotemporal modeling frameworks that provide early warning of increased risks of mosquito-borne diseases. So this is really evidence-based. So we can really use this to make more informed decision about where we carry out the vector surveillance, where we carry out the control measures, because we can't do it everywhere. And modeling is really critical, as we've heard about in many of the talks with climate change, to understand where the risks are, what areas the risks are, where the vulnerable populations are, which areas do we need to target our control measures, which areas do we need to target our intervention strategies. And my final comment is, as I think James has said before and others have said before, we do have a dearth of data in the Caribbean. We need to collect more data to inform these models. Models are useless if you haven't got the right data to go into them. And we need to collect that data on vector competence, collect that data on vector movement, collect that data on surveillance of zoonotic panic, so we can use that data to inform models to really then, as I said, use it as evidence-based for making decisions to reduce our risks from these type of diseases. Okay, thank you very much for listening. I'd like to thank especially Professor Matthew Bayliss, who helped me with some of the slides. He's a colleague and friend from the University of Liverpool who's been working in this area quite a bit. I'd like to just point out this free book, Caribbean Resilience and Prosperity Through One Health, which I wrote with some colleagues, which gives a great idea of some of the work we're doing across the Caribbean in the area of One Health, and does mention there's a very nice article on climate change in Jamaica as well, which I would really like you to read. You can download this freely in this website here. Take a look. I would say it's an interesting book. And if any of you have any questions, please feel free to contact me. Here's my email now. So that brings me to a close. I would like to just say that I will now do my level best to answer your questions. I have James with me, luckily, so the terrible twins, who will help me, because I'm sure I'll need it. But we'll between the two of us, we will do our best to answer any questions you have. It's been a pleasure having this opportunity to talk to you, and I hope you found the talk interesting and, most importantly, useful to you. Thank you.
Thank you very much, Chris. Ladies and gentlemen, I think we should give him a big round of applause. You know, it's always great to have a lecture from somebody who loves their subject. Chris's enthusiasm was just overflowing. He's a vet, you know, my wife's a vet, so we have One Health at home. And we have, if you live in the Caribbean, like many others, experienced some of this. We've had dengue and chikungunya and Zika. My wife and daughter both had dengue hemorrhagic fever. So we're really seized of the importance of this. Well, thank you, Chris. Chris reminded us of a lot of things that with the changing climate, we will see changes in the patterns of vector-borne diseases, both increasing and decreasing. My sense is, and I posted a link in the in the chat, that for Aedes aegypti-borne diseases, the trend is towards increasing transmission globally. So we've in my watch at CARFA, I fought dengue for years, but we had Zika, we had chikungunya, and those were brand new emerging infectious diseases for us in the Caribbean. We had epidemics here as part of global pandemics in the world. And he reminded us about zoonoses and that COVID is in fact a zoonosis, having spilled over from the animal population. The world has had about 100 pandemics in the last, about 10 pandemics in the last 100 years. And most of those have come from human-animal contact. So really important stuff. Thank you very much, Chris. We are now going to switch over to the Q&A. And you're the man of the moment. Where I can, I'll chip in. Lots of comments in the chat for the quality of the presentation. And somebody else earlier said you were her favorite presenter at UWI. So that's a good accolade. So now we're going to switch to the business of the question.
Start off by asking the first question. Can I take that privilege?
Go ahead, Paula. Dr. Henry, go ahead.
So, yeah, so I'm going to ask, I have tons of questions. By the way, you're great as usual, Dr. Ora. And I have many questions, but I'm going to start off with a very easy question. And this has to do with bats. And basically the question is, should I take this advice sitting down? Now, I have always had to live with bats, okay? Probably for the last 40 years. I always have bats in my house. And everything else, and COVID made it worse, right? You had more of everything else in your house, right? Even snakes coming closer. Birds, oh, more birds, they want to live in the house. And how I deal with my bats really is that I know they like nocturnal, they like darkness. So they tend to come in at night and they intend to inhabit certain areas like the laundry and certain areas like my other kitchen. So I will always make sure to keep the lights on. If I forget for a day or two, the bats will come in there and they would live. Okay? Okay, so this, now you have talked a lot, we have had a lot of change of land usage patterns because where I live initially, we just lived there, but now there are many other houses. They've cut the forest, and this, including climate change and including the fact that we have a change of land usage patterns, we have more of these bats wanting to come to live in the house. Okay, but this is the question, this is the thing. And you talked about animal reservoirs that really got me thinking as well, because we have dogs. So my daughter, who's also a physician, she realized, okay, she also has a lot of bats coming into her house. So she went to get help from the people who help you with this. And they told her, no, we can't do anything for you because bats are now a protected species. And I want to know, I told her, girl, I don't know anything about that. So I'm asking you as a professional, shall I take this line down? Because you started talking about vampire bats and outbreaks and rabies and dogs. And because if the answer is, if you tell me to do something about it, I will do something about it. So that's the question. Shall I take this advice lying down or sitting up?
Thanks, Paula. When anybody asks says a question, this is an easy question. You know there's going to be a difficult question coming your way, but it's an important one. It's an important question for Trinidad at the moment because we do have an outbreak in the south of Trinidad of rabies, which is spreading between vampire bats and ruminants. So we do have to take that seriously, certainly in areas where rabies is spreading. But I must emphasize that we mustn't demonize bats. Bats do an enormous amount of good for the environment. So the last thing we want to do is go into our houses where bats have been present or you know, are usually present, and start killing bats in the air, in our houses. So there is in some cases, like in the south of Trinidad, where there is an issue at the moment with vampire bats, increasing numbers, in a controlled way. The anti-rabies unit is carrying out some controlled culling of some of the bats. However, this is targeted towards the vampire bats. The bats coming into your houses, Paula, will far more likely to be the other forms, fruit bats, insectivorous bats. And if they keep themselves to themselves and they don't bother you, I would say my advice would be to leave well alone. I will revert to James in a minute because he's had a lot of experience with this. My advice would be to leave well alone. However, if you do see bats or a bat that's acting strangely, because they do get clinical signs as well, bats, then you should maybe take some precautions, and there are elements in place. You can report certain bats that are acting strangely to the rabies unit in the country, and they should come investigate. But it's another thing, you know, we should make sure that we realize that bats are extremely useful, and they should be protected, and they do an enormous amount of good for our nature and our environment. James, over to you.
Thanks, Chris. No, I would agree with you on that last point. Bats are an important part of the environment. Unless any viewers think that we have an outbreak of human rabies in Trinidad, we don't. The last human case goes back to the early 1930s, so almost 100 years ago.
Yeah.
Trinidad does occasionally experience outbreaks of rabies in cattle, in areas where there are vampire bats. So that's what's been going on in the south of the country, and has the Ministry of Agriculture has stepped up control measures. We get bats in our house all the time, and unless they're behaving strangely and potentially sick, we generally ignore them or try to keep the windows closed so they don't come in. Thank you, Paula, for that. We've got a lot of questions to go through, so we've got about just under 20 minutes. So I'm going to go through it about one every minute or two, Chris. So let's start from Chris Ann Lawson. What's the temperature associated with the extrinsic incubation period for Lyme disease? I'm curious, as I realize in Jamaica we have a lot of tick bites, but we don't seem to have any Lyme disease outbreaks.
Very good question, and it's it's one that I actually cannot answer. If you ask me about the midges or the mosquitoes, I'd have a much better answer for you. James, do you know about that? Are you able to answer that question?
I'm not either. I mean, to have a disease, you need the vector, and you actually need the pathogen, and you need a host that will get it. And perhaps the issue is that we don't have the pathogen in the Caribbean.
Yeah, that's certainly true. I think what's happening in the US with the Ixodes ticks is they're actually moving further north because they're finding that they're finding that their habitats, they're able to survive in the as a temperature gets warmer further north, and they're finding very nice habitats further north that they really enjoy being in. So and of course the parasite is there as well. I don't think we have it in Jamaica. I'm not sure, but I don't think we actually have the parasite in Jamaica.
Thanks, Chris. I see we've got some Canadian or people in Canada viewing, and I know that I've got a colleague in Alaska who's telling me that the increasing temperatures are causing the ticks to spread further north, and they overwinter. So you get a lot of tick fever in the caribou herds, and they're decimating them. Question from Gary Joseph. What percentage of zoonotic diseases can we reduce by reducing human encroachment into wildlife habitats?
We could, well, if you think 75% of new and emerging diseases in humans have come through animals, they have that link between animals and humans, between often wildlife and humans, has enabled that because they've got to jump across. So the answer to your question is you could get rid of a lot of them if you if you respected that link. I didn't think you get rid of all of them, but many are because of direct close contact. Many of the influenzas we've seen have come across through very direct close contact. COVID came through likely very direct close contact. HIV came, we think, through very close contact. So we could reduce a lot of them if we protected our if we reduced that opportunity.
Thanks for that, Chris. I saw a paper recently, I'll try and find it, that there are some 15,000 viruses that could potentially spread from animal to human populations as climate change advances and as we encroach more and more on animal populations. So that's a key factor in more deadly pandemics, humans encroaching onto animal populations. And you mentioned all the others, international travel, the climate itself, the heat. There's one that you didn't mention, which is the vulnerability of the human herd, if you will. And because with aging and with all the non-communicable diseases we have, you have a population that's very susceptible to serious adverse effects of these new and emerging diseases. Question from Anisma Gukul. Can it be predicted that with climate change, humans will become more susceptible to catching zoonotic diseases because the vectors will be able to adapt to the effects of climate change?
I think that I think it is likely that that vectors will adapt. Yes, I mean we will. We are all species. All species are very adaptable. So yes, I think it is likely that there will be some adaptation. So yes, it is possible. It is possible.
Thanks, Chris. A question from Dasaev Bryce. I would like to know if research exists on mapping vector-borne diseases per region on the planet. He's curious to know about the most new vector-borne diseases in the Caribbean region, as I think it's a critical point for updating therapeutic guidelines.
Yeah, absolutely. And this goes back to the data that's needed to inform models. You're absolutely right. Some areas of the world there's a lot more data on the vector-borne diseases and the vectors, so they're able to have more accurate models looking at risks. There's some areas of the world where there is very little data, and Caribbean, I'm afraid there is a dearth of data. We still need to get a lot more data together. So you're absolutely right. This is an area that we need as scientists, we need to work very hard to bridge that gap.
Thanks, Chris. I could perhaps add to that at a broad brush level, dengue has been increasing in frequency and severity for the last couple of decades. And I would remind our audience, dengue is not one disease. There are 4 serotypes of dengue, and they behave somewhat independently of each other unless you get 2 of them in quick succession within a year or 2, when your risk of dengue hemorrhagic fever increases. Additionally, we've had in the last decade chikungunya in 2014, 2015, and we had Zika in 2016. So those were brand new diseases. So I would agree that updating therapeutic guidelines in the light of more frequent and severe dengue, so So clinicians to take account and think about dengue hemorrhagic fever. It's really important how that's managed. To think about Zika and Chikungunya. If the inter-epidemic period of chikungunya is similar to dengue, around 10 years, then in the next year or so, we might well have another outbreak of chikungunya. From Cassandra Alonso, is there a difference of temperature in the transmission of dengue between Aedes aegypti and Aedes albopictus?
They do have different geographical locations. So they, I am not 100% sure. The question you're asking is whether they have whether the different temperatures or temperatures affect their extrinsic incubation periods in different ways. My inclination would be to say, because they live in slightly different geographical areas, the answer would be yes, but I'm not sure whether that's the case. I don't know whether you know, James, but I'm not sure. I think it's likely to be the case, though.
Thanks, Chris. I'm not sure either. It's likely to be the case because they live in slightly different habitats. The Aedes aegypti is the hairy-domestic mosquito that's going to be breeding in containers in and around the house, in drums, in tanks, in tires. And as the temperature warms up, that's going to affect Aegypti. Albopictus is more in forested and bushy areas. Question from Lennox Seeley. Are you aware of a climate-sensitive health surveillance system that collects data that you're talking about? We're working on a project like this right now.
Yeah, hi, Lennox. Yeah, very, very, very good question, and it's something that it would be great to do. I am not aware of that kind of project myself, but it's certainly something that I would say should be done. Are you aware of any projects of that, James?
Not in the Caribbean. Some folks have worked towards a more integrated environmental health system, and where Jamaica has done that. And globally, some of our work has come across a very interesting system in Madagascar, where they're pulling together climate indices, environmental indices, and human health epidemiological indices. We're in discussion with some of the principals at Harvard about how that is being done, because I think the Caribbean countries need something like that. We've got the Met Office that's putting out data on heat and rainfall and dust and so on. And we've got to see how that's connected to what happens in the environment and then what happens to human health impact. Question from Gary Joseph. Can you give examples of infectious diseases that have disappeared or been eliminated due to the effects of climate change and not due to human intervention?
Good question. I can give you some infectious diseases that have disappeared, but due to climate change, I have nothing from the top of my head. Certainly, there are examples of diseases that have reduced significantly, as you saw from the models, that have reduced in severity due to climate change in certain areas. And we showed those models that because the temperatures rise to above that threshold of the vectorial capacity, when it starts actually not being able to survive in the vectors as efficiently, then it starts going down. So I think we will see more going forward in certain areas of the world where actually vector-borne viruses that will reduce in prevalence because they're not able to transmit anymore. But off the top of my head, you've certainly seen it where for example, higher altitudes in Africa, you've seen increase if the vector-borne disease are able to transmit where they haven't been transmitted before. But it's really the very hot areas, when it gets too hot, too hot for the virus, too hot for the vectors, that we're going to see the reduction, and that'll happen as we move forward in some areas.
Okay, so we've got about 6 minutes left and about 6 questions. From Maureen van Dijk in Suriname, are you aware of publications on the use of knowledge of indigenous people regarding emerging diseases?
There's not enough. Absolutely critical, I would say, to get more data, because as you well know, indigenous populations have a lot to give. They have a lot of knowledge in these kind of areas that we need to take from them. There will be publications, I think, but I'm afraid I'm not aware of them. But it's an area that really should be investigated more. The knowledge, getting that knowledge that the indigenous populations have and applying it.
Maybe that's something we can get back to Maureen on. From Karen Lewis Bell, can you discuss the importance of cooking meat thoroughly and reheating of same and the implications for spreading of pathogens?
Yeah, very much. I mean, most pathogens are sensitive to temperature, and the kind of temperature you get when you cook is going to kill nearly all pathogens. So that is the most critical last point. If the pathogens have got all the way through to that stage where they're present in the meat, if you cook that meat properly, that'll kill them. So yeah, really important.
Thanks, Chris. And from Vinod Sivarath Miser, what product protects best against infect vectors that cannot easily be seen? DEET does not appear to be very effective.
That's not my area, I'm afraid. I can't answer that. I'm sorry. DEET, yeah, I know from experience from your question, even if sometimes you put some DEET, some products on, you still get bitten by mosquitoes. So maybe they're getting some kind of resistance to it. But there may be others, natural products. They don't seem to work particularly well in my experience, but I don't know whether you have experience, James, with those kind of products.
I don't, but that looks to me like an interesting question to tie to indigenous knowledge and whether
Yes.
people of indigenous origin are better equipped in that regard. Question for Vanessa Green. What does the data evidence say refogging as an effective method of vector control?
Fogging, again, not really my area of expertise, but fogging is effective, but it does have implications on the environment as well. I mean, we all know that when we have fogging in our areas, the amount of mosquitoes goes down significantly. But it has to be done in a measured way. You have to do it so you take into consideration the life cycle of the mosquito. So you might want to do it periodically. So you take advantage of making sure that you don't get re-emergence. So there are protocols that should be done, not just once and then that's it. Over to you, James, on that one.
Yeah, no, you're right. If fogging is going to be done, it can be effective, but it has to be fairly frequently applied, which has impacts on the environment. And it's got to be done in conjunction with reducing sources of breeding. You could just think about it. If you fog and all the drums and tires and water tanks are still breeding mosquitoes, then the fogging is not going to be very effective. And now a great question to perhaps end on. How is climate change increasing the risk of more deadly pandemics?
Well, what climate change is going to have so much effect on people generally moving around, trying to find food, trying to find a better environment to live in. So that you've heard about climate migration and the movement of people, because we have, as I said in my talk, one of the big issues we have is population increase. So people are going to be moving much more to find a life, to find a new area to live. And in the process of that, and that's climate driven. And in the process, they are going to be moving in closer proximity to the wildlife and possibly the livestock that have those thousands of potentially viruses that are potentially going to cause pandemics that James talked about earlier. So it's all about effects of climate change that are going to enhance or increase the movement of people so they become closer, more susceptible for that spillover to occur. That's the main reason. That's the main reason we want to think about. We want to avoid that close proximity.
Thanks, Chris. So, well, it's 7:30, and I want to thank you very much for your lecture. Sorry we didn't get to all the questions. We'll see if we could give a follow-up answer to some of them. The chat had a lot of good inputs as well, including natural mosquito repellents and pointing out that fogging kills indiscriminately good and bad insects. So thank you very much, Professor Aura. Paula, you have your hand up. You probably got a reminder on the CME, is that right?
Before you close, very importantly, thanks for that very great lecture. We obviously need to meet again at some point in time because we have so many unanswered. However, I want to remind you of your CMEs. Please, if you want your CMEs, you have to fill it out, and also payment. This is the last day for payment. If you have any questions, feel free to email me, phenry@earthmedic.com. Can you post that in the chat? Right, it's there. And I will be trying to be available to answer your questions because today is the last day for payment. Thank you.
Thanks, Paula. Thanks again, Chris. Thanks to our great audience. Well over 200 folks listened to tonight's talk. I certainly enjoyed it. As I said at the beginning, Chris's enthusiasm was just overflowing, and it's great to listen to a lecturer who loves this subject. So thank you all very much. Good night and stay safe, everyone. See you next week.